Ever spotted one of those funny little bumps right near your fingernail, maybe a bit shiny?
Yeah, often disappears out of nowhere.
Exactly. Well, today on the deep dive, we're looking at myxoid cysts. You might also hear them called digital mucus cysts.
That's right.
We've pulled together the key info. Our mission really is to give you a clear, high-yield understanding perfect for revision.
Yeah, definitely. We're talking about these benign, fluid-filled sacs. They tend to pop up near the nail bed or that last joint in your finger, sometimes toes too.
And they're linked to the joint underneath.
That's the key thing, their connection to the joint. They're not usually dangerous, but, people worry about how they look, or sometimes they can affect movement a little.
Okay, so let's really nail down that definition. It's a benign skin thing.
Correct.
Location near the nail or the end joint.
Saw it on.
And inside, it's this gelatinous, jelly-like fluid.
That's right. And always think about that link to joint degeneration.
Got it. Maybe a little memory tip. How about mucus near my nail joint?
I like it. Simple, covers the basics.
So the big question, what actually causes them? Do we know?
Well, the honest answer is the exact cause isn't fully known.
Oh, okay.
But the main theory, the leading idea, points towards degeneration, sort of a breakdown of the connective tissue around that joint.
Like wear and tear.
Pretty much, yeah. Things just wearing out a bit, possibly triggered by other factors.
And what might those other factors be? Our sources mention things like mechanical stress.
Definitely. Repetitive little traumas, even ones you don't notice. And underlying joint issues are a big link.
Like osteoarthritis.
Osteoarthritis is a common one, yes. Rheumatoid arthritis is also mentioned sometimes.
Okay, so that brings us to who's most likely to get these, the risk factor.
Right. We tend to see them more as people get older. So advanced age is one.
Makes sense with the degeneration idea.
Exactly. And interestingly, they seem to be a bit more common in women.
Okay.
Also, a history of joint problems, like we said, or previous stinger injuries. That increases the risk.
And jobs or hobbies?
Yeah, anything involving lots of repetitive hand or finger movements could potentially contribute.
So maybe another memory tip. Aged females with joint issues doing repetitive tasks.
That works. Covers the key groups.
So moving on to the pathophysiology. What's actually happening at the tissue level?
Okay, so patho is basically what's going wrong. Here, it looks like that connective tissue around the joint starts to degenerate.
Right.
And then maybe because of stress on the joint or those underlying conditions, the body forms this little cystic structure.
And that fills up with...
That fills up with the mucin-rich fluid. That's the jelly-like stuff we talked about.
Gotcha. Now, if someone finds a lump, it might not be a myxoid cyst. What else should be on the radar? The differentials.
Good point. You always have to consider other things. Ganglion cysts are common, often near tendons or joints too, but maybe look a bit different.
Okay.
Epidermal inclusion cysts, those are another possibility. Little skin cysts.
Right.
Fibromas, which are benign growths. Even warts can sometimes cause confusion. And although much less likely, you technically keep benign or malignant tumors in the back of your mind.
But usually you can tell by looking.
Often, yes. The location and appearance are quite typical for a myxoid cyst. A clinical examination is usually enough to differentiate.
And are they common here in the UK? Is there much data?
Specific UK-wide stats are a bit thin on the ground, actually.
Right.
But clinical experience tells us they are relatively common, particularly in older individuals and, as we said, more frequently seen in women.
Okay, let's get practical. What does a typical one actually look and feel like? Here's a good recall question for you listening. What does a typical myxoid cyst look and feel like?
So typically you're looking at a small nodule. It's usually quite firm, maybe rubbery. Often looks a bit translucent, sometimes shiny. You might even see a slightly bluish hue through the skin.
And always near the nail or end joint?
Predominantly, yes. Near the nail bed or the distal interphalangeal joint, that last finger joint. Sometimes they can even press on the nail matrix and cause a groove or deformity in the nail as it grows out.
Painful.
Usually, no. They're typically painless. But they can become tender or sore if they get knocked, inflamed, or if they're pressing on a nearby nerve.
And can they burst?
They can, yeah. Sometimes they rupture spontaneously or with minor trauma and leak that clear, thick, jelly-like fluid.
Okay. So diagnosis is mostly clinical then. Do you need investigations?
Primarily, yes. Diagnosis is based on that characteristic appearance and location.
No tests needed usually.
Not routinely. However, if the diagnosis isn't clear or if there's suspicion of significant underlying joint problems like bad arthritis, Imaging might be used.
Like what kind of imaging?
Maybe an X-ray to look at the bone and joint, or sometimes an ultrasound can help confirm it's a fluid-filled cyst and check its connection to the joint.
Right. Let's talk management then. Someone has one, it's confirmed. What do we do, particularly here in the UK?
Well, often the approach is quite conservative. If the cyst isn't causing any symptoms, no pain, no functional issues, just observing it is perfectly reasonable.
So wait and see.
Exactly. Watchful waiting. Many don't need active treatment.
But if it is symptomatic, painful, or getting in the way?
Then you look at options. One simple thing is aspiration, draining the fluid with a needle.
Does that work well?
It can provide temporary relief, but, and this is important, they often come back after aspiration alone. The recurrence rate is quite high.
Ah, okay. So what else?
Other options include things like injections or ultimately surgical excision cutting the cyst out.
Yeah.
That tends to have a lower recurrence rate, especially if the connection to the joint is properly dealt with.
Okay. So overall prognosis, long-term outlook, and any nasty complications to worry about.
The prognosis is generally very good because, remember, it's a benign condition,
Not cancerous.
not cancerous at all. No serious complications are typically expected.
But the recurrent.
That's the main thing. Recurrence is common, especially after non-surgical treatments. That's the key takeaway on prognosis.
Some memory tip. Benign, but can come back?
Perfect. Sums it up nicely. If they keep recurring or are really bothersome, surgery often becomes the most effective option.
Great. So just to quickly wrap up, Myxoid cysts are those little benign, fluid-filled bumps, usually on fingers near the end joint or nail, linked to joint wear and tear. Mostly harmless, but can be cosmetically annoying or slightly uncomfortable. And importantly, they have a tendency to recur after simple treatment.
You've got it. And it's a good point, actually. Even something that seems minor like this can really affect a patient's quality of life sometimes.
Yeah.
So understanding it properly is crucial.
Absolutely. Well, hopefully this deep dive has helped clarify things for your revision.
Hope so.
And remember, for more high-yield MSRA revision materials, do check out pastthemsra.com and our free resources over at freemsra.com.